Good evening, everyone. I hope you can hear me. If you can hear me, please leave a thumbs up. I've muted the meeting for everyone except myself and Desmond, just to manage how things are moving. And we'll begin now because we had set to start at 6 p.m. Welcome to the first episode of the podcast, where these are conversations we have for and about animals and about their welfare. My name is Naomi, as most of you may know, and I generally am concerned about animals and their welfare. And I started this so that we can do a bit more of education and interact much more with the online community and learn more about animals and the welfare that we need to create around them. If you have any questions or comments, please feel free to leave them in the chat. I'll be taking the questions at the end of the session. Desmond and I will take you through a session about humane animal population control and what we generally call spay and neuter. So karibu sana everybody, and thank you for joining us. Okay, so let's begin by introducing Dr. Desmond. Dr. Karibu, please feel free to unmute yourself and introduce yourself.
Hi everyone, my name is Desmond. My name is Dr. Desmond Tutu. I'm the vet for TNR Trust, Nairobi. I'm a graduate of Nairobi University, and my experience now is 11 years in the field. So I've had a good time practicing veterinary medicine, and I've worked with, I've been in a clinic before for 4 years. Then I worked with a private security company also for 4 years, mainly handling dogs. And now this is the 4th year for TNR. So it's been a good time. Main work at TNR is mostly mass vaccination and spay neuter. And our main aim is to control rabies, which is a zoonotic disease. And we know it can only be controlled by vaccination. So the main reason why we are doing spay neuter is because if you just do vaccination and don't do spay neuter, the numbers quickly overwhelm you, and you might not be able to achieve the over 70% of the population vaccination. So that's why we advocate for spay neuter. The concept is still picking up very slowly, but it's now a household conversation, and at least everyone who keeps a pet have an idea what spay neuter is.
Okay. Thank you, Dr. So Dr. Desmond, he may not say very much about himself, but I consider him one of the best veterinarians, and especially as a surgeon. He's known for his skill and speed, especially very lightning speed at spays and neuters. He can handle almost 50 patients by himself in one day, if not more. So it's very great to have him on board for this session. I think he's one of the leading experts when it comes to spay and neuter procedures. So as he said, he works with TNR Trust, and TNR Trust is an NGO that basically focuses on stabilizing dog and cat populations and also the management of rabies. As Desmond has said, rabies is a zoonotic disease, so that means it's transmissible between humans and animals. And the fact that it's such a risky disease where once you contract it, basically your days are numbered. The way the disease progresses amongst humans and animals is very fast, and it's a very painful process for both humans and animals. So the control is very critical worldwide, and it's monitored across the world. So TNR Trust is a volunteer-based organization for the most part. They work to provide services, especially to underprivileged communities, carrying out mass spay and neuter and rabies vaccination campaigns across the country. You can always reach out to them if you think you have stray cats and dogs that need to be managed, and they will reach out to you and create a program that can help facilitate those procedures. All right. So today we're going to talk about humane population control for animals. And this involves procedures that are well thought through in terms of the welfare of the animal. So we want to be able to uphold animal welfare, uphold safety and care for them, and uphold the freedom to life for them. So it's not about mass culling and poisoning and such procedures. So Dr. Desmond, if I may, would you be able to explain what exactly, especially as a veterinarian, what humane animal population control really means?
Thank you. Animal population control basically mean you control the breeding in animals, because animals breed freely. Once they attain the maturity, or rather the reproductive age, they are free to breed. So, because we are human beings and we know we can only accommodate a certain level of animals amongst ourselves, we have to control how much they breed. So the human word here means that when you're controlling their breeding, you must look at their welfare, that you do it in a manner that is safe for them, with less pain, and also that you manage any side effects or infection that may come from controlling their populations. Methods that are available are basically you can do spay, and also you can do neuter in males, and you can also withhold your animal until the breeding season ends. For dogs, it's normally it runs for about 2 weeks, meaning they have 9 days of spotting before they spot blood, before they are ready for mating. Then there's another 5 days after that when they are actively that they can breed. Most of the time we advise people to keep their dogs until 3 weeks, because most people don't notice when actually their dogs start going on heat. So you may miss the timing, so that you release your dog when they're still actively in season and they can easily be bred by when you don't intend to breed them. For cats, it's very difficult. If you don't have male cats around, or if your cat is exclusively an indoor cat, when they come to heat, it's very irritating, the sound that they make, how they behave, and they are actually in distress. So you'll easily notice that they're on heat, and the distress will cause you a lot of discomfort. Most people think that their cats are actually sick. A cat that is freely roaming on outdoor, you will never even notice that they are on heat. If the cat is not feeling safe at home, she'll even go ahead and have kittens somewhere else, and one day just show up with kittens that are about 2 weeks old. So that's why we insist that if you're keeping your animals, you must control their rate of breeding, and that's what we mean by humane animal population control. Locally, people use other methods that we really don't advocate for, and we are actually campaigning against them. When you go to the communities, you find people use things like rubber band on males, or people use just live operation. What they don't know how to do is very traumatic to the animal. People use razor blade, people use knives, and they actually slit the scrotum and take off the testicles, which is very inhuman to these animals. If you look at the females, people use injection, which we actually advocate against. This injection is not safe for your animals. It's not meant for veterinary use. It's an animal, is a human product that people use on animals. There are some vets who use it safely, I would say, but the long-term effect is not good for the animal. It results in other conditions that if we start talking about now, we'll spend the whole time. But the baseline is that this injection is not safe, because once you don't time the cycle of your animal, you will not know when you're doing it. You might do it when your dog is already on heat, or when your dog is already bred. This dog will end up with pyometra. If your dog is already bred and the puppies are in there, then these puppies will die. And we've done so many operations in the field where we've run into to cats and dogs with puppies dead inside. And it basically, the owner will tell you, yes, there was a vet who came and gave the injection, and we thought that it was time now to do the surgery. But they did it when the cat was already bred, and the kittens were in there, and they died. So it's very traumatic. It's risky. Sometimes you do it, and then your cat start discharging. It's the cat just losing weight and keep on cleaning herself, because cats are very clean. We'll clean herself, you might not notice until this effects start taking toll on her life. She starts becoming lethargic, not eating, and now just feverish. And you take it to the vet, and then they find out that you did the injection and the kitten's already there, and now you are the one who is actually risking the life of your cat. So it's something that we strictly advise people, don't do it. Even if you look at the cost of doing the injection over a period of time, if you do it over a period of, let's say 1 year, I think the cost basically comes to the cost of doing a spay. So we are telling people, please don't do this injection. If you want to adopt, if you want kittens, if you want many cats, we have KSPCA where you can adopt as many cats as you want to keep. We have the Nairobi feline where you can also adopt as many kittens as you want to keep. Good thing is that these kittens, they come out, and once they attain the age of spay neuter, you can still organize with KSPCA to go and get it done for you, but at a cost. Or you can also organize with your vet, who can also do it to you, also at a cost. But now all these costs that we complain about depend on your relationship with your vet. Vets nowadays have devised payment plans. Just agree on a price. Don't press your vet too much. Give him a good price to cover his cost, and also to make sure that you don't feel the pain. So you distribute the payment over time. There are several clinics that are already doing that, and you can consult your vet. You agree on a price, then you pay them in good time. Then they do for you the surgery, and you have no worry. Please don't do the injection. It's not good for your animals.
Okay. Yeah, it's very important that people understand that contraceptives are made for humans, especially the ones in the market. Yes, they've been tested on animals, but no safe contraceptives have been developed for animals. Now, when it comes to spay and neuter, would you explain to us what the difference is in the terms? Because there's spaying, there's neuters, there's castrating, and the terms are sometimes used interchangeably.
Okay, I think the term neuter would generally refer to both male and female surgical birth control. You can use it on both males and female, but we prefer using it on males, just to make it clear that it means castrating the male. But neuter can refer to both either female or male. It refers to the procedure both in males and female. Spay, specifically, you are referring to the female. It involves the surgical removal of ovary and also the uterus. So when somebody talk about spay, they mean doing an operation on a female, either dog or cat, to remove their breeding ability. So the vet actually put the animal under anesthesia, and they go in, remove the ovaries, what we call ovariectomy, and also they remove the uterus, what we call the hysterectomy. So because it involved both of them, now scientifically it's called ovariohysterectomy. So spay basically refers to the female. Now, when you come to castration, it's also specific to male. Castration is what scientifically we call it ochiectomy, meaning you surgically remove the testicles and also remove the spermatic cord. You are advised to remove the spermatic cord as much as you can, so that you don't have long-term effect of retained semen in the vas deferens. Because the vas deferens is as long as the spermatic cord. So the more you remove the spermatic cord, the more you remove the vas deferens. Once you do the castration, the dog can remain active for some time because of the retained semen in the vas deferens. So this dog, within a period of time, may still be able to mount and actually sire babies. Sire puppies. We are animal people, and we refer to animals with the human term. So if I say babies, I don't mean human, I mean puppies. So that's something that vets also watch out for. And people also do castration to control behavior, and other than just to stop the breeding, they do it to control behavior. So after castration, the male traits may still be there for some time. We normally say between 8 weeks to 16 weeks. And this is a period when the dog, if it was because of aggression, the aggression may still be there. If it was just because of roaming around, that effect may still be there. So it's always advisable that vets prepare their clients and get to know the exact reason why they want to do the castration. If it's because of aggression, you tell them the dog has to be given some bit of time and undergo some aspect of socialization, and also must also be retrained somehow for this trait to go down and for the dog to learn his new way of life. Spay basically is done for to control breeding, but we can also do it medically when a dog has pyometra or when a dog has ovarian cysts or ovarian tumors. Other conditions, other times when we do the spay is when the vet actually advises the owner the reason why the dog is having difficulty when he's giving birth. So this is at the time of doing cesarean section. So when you do cesarean section and you realize this dog, the breeding future is not even worth it, you go ahead and do the spay, and then you do this cesarean section, but do the spay at the same time so that this dog doesn't encounter similar problem in the future breeding. And this refers to specifically dedicated breeders, people who know how to breed, and they breed for business, and they follow animal ethics when they're doing breeding. If you're keeping a dog and you don't intend to breed from it, please just do a spay. It will save you cost, it will save you a lot of problems with the dog, and also it will reduce chances of the dog getting issues like the pyometra I've mentioned, and also the ovarian cancers that come along with it. At what age do we do all these procedures? For reputable breeders or for careful and people who are very responsible with their animals, we will advise them to do it from as late as 2 years. But because we know our systems and how things work in Kenya, and mostly our situation with our homes and also the streets where we want to walk the dogs, we want to take the dogs to Karura Forest for socialization, we always advise that spay the dog as early as it attains the breeding age. So we target 6 months. There is a lot of literature and a lot of information on the internet against spaying at earlier than 2 years, because the hormones that we are eliminating are also associated with the animal's development. But you look at the bigger picture. Would you want to have your dog stay on 2 years and give birth more than 4 times? Where will you take these puppies before you consider it mature enough to do all these procedures? If it is a male, we also advise that you do it as early as 8 months to 1 year. But for somebody who is responsible, has a good compound, and they can control their dog, and is basically having pure breeds like maybe a German Shepherd or a Rottweiler or a Labrador, then it's advisable that they wait until the dog is 2 years. But look at the situation. Look at the benefits that you're trying to control versus the risk that you're avoiding. So that's why we target the 6 months. Again, our main work is basically on the stray dogs. A stray dog or a stray cat has no place to wait for all that time. It will be having over 200 puppies before that they attain that age. If you look at the tree of reproduction, if it is 2 or 3 dogs in your neighborhood and you want to wait until they're 2 years before you do the spay, trust me, you will have over 50 dogs or 100 dogs within the community, and they will be a nuisance. And our target, that is rabies, in case one dog gets rabies, now the whole society is at risk. Even your dog that you lock at home and you take good care of is at risk of getting the rabies. So the campaign against early spay neuter is basically for breeders and people who are responsible and can actually take good care of their dogs, know when their dogs are ready for this spay. For our dogs that we keep freely and we want to go to social places with them, we want to have them live their life freely, there's no harm in spaying your dog between 6 months to 1 year. It just saves you a lot of problem. If you don't have space, if you don't have, if you have where you live, your fence is not properly done, then it's good just spay the dog. Then you forget about all this. Yeah. So the age debate is a very thorny issue, because people are now starting to blame vets for advocating for earlier spay neuter. But I think it's advisable that you spay your dog as soon as they attain the reproductive maturity, so that you also save us from the excessive work that we have to do. We have to keep on fundraising to control this population. And when rabies strike, it is a panic for everyone. If just one dog with rabies is amount to an emergency, because you don't know where this dog has been, how did it get this rabies, and how is it interacting with other dogs in the community. Based that we know how rabies spread, how rabies develop from the time the dog catches it to the time the dog become actively vicious, biting everything, to the time it gets paralyzed, and finally when it dies, it will have interacted with so many dogs and also so many cats, leaving the virus in the community, risking everyone who is there, especially the children who are walking to school. We might look at our society that we take our children to school in school buses and also in our own private means, but look at the middle level or the low income earners, people who actually their children are walking to school, and it's everywhere. You go to Laresha, you will see children walking to school. You go to Lavington, you see children walking to school. You go to Karen, you see children walking to school. So you can't say a specific area is not rabies risky. And the recent cases of rabies have been in very, very high-end areas. There have been rabies in Karen, there's been rabies in Rongai, there have been rabies in Ridgeways. Yeah. You can't say rabies is not there. It is there. And these are just suspected cases. Then once the word rabies is mentioned, we say, okay, because of risk of zoonosis, let's take this dog or this cat to Kabete for sampling. Then it turns out it is rabies. Last year I had 4 post-exposure vaccinations because I handled cases that we thought were dogs desperate for veterinary service. But eventually, when we suspect this case of rabies, it turns out the dog is positive. And that's why we insist, if you spay and neuter your dogs, because you are the one who are able to provide food for your dog, and then the dogs become very fertile and breed anyhowly. If you spay and neuter your dog, the society will be very safe from rabies. We can easily get rid of dogs from the street.
Okay, I have 2 questions for you, again on spay and neuter. We've seen cases where kittens are neutered very early, sometimes from the age of around 3 months to 4 months. And then sometimes we have to spay pregnant mothers. What do you think about that? And this can be your personal opinion, or what is advocated for them?
Spaying kittens when they're too young only predispose them to urinary incontinence, meaning the reproductive tract doesn't have enough time to mature to be able to control all this, the urinary and the reproductive functions. So we advocate that don't spay your kitten when it is too young. Yeah, if you have a chance that you can go back to the vet, please take allow your kitten to mature, then take it when it's already over 6 months to be spayed. The earliest we've encouraged spaying is from 4 months, and this is when we go deep into the villages where we don't know when exactly will we ever come back. So we evaluate when a kitten is about from 4 months, we take the risk and do the spay. But if you have your own kittens at home that you can actually wait until they are 6-7 months, please wait. Yeah, the advantage to the kitten are higher than spaying it earlier. On the aspect of spaying a pregnant mom, we normally look at the situation. If it's a responsible owner who can actually afford vaccination for the kittens and will definitely find homes for them, then we advise, please wait for the kittens to come, then let's spay the mom when the kittens are about 4 weeks, when their eyes have opened, they are able to eat and they're able to be independent. When we go to the field where we don't have a choice, the owner herself, you actually declare to them that your cat is pregnant. So we have 2 options. We can terminate the pregnancy by the fact that you would not want to have more kittens at your place, or we give you room, you make a decision that you want the cat to have kittens, then you can bring the mother later for spaying, and also the kittens when they mature, you can bring them in for spaying. On my personal opinion is that the emotional attachment to the animal is when you have actually seen these animals. Yeah, a pregnant mom may be having I would say you have not seen these kittens, so you don't know what exactly is in there, but you expect that they are kittens. So from the veterinary perspective, I would look at it in two scenarios. One, if there's risk that these kittens are going to suffer, or this mom would not have proper food to feed these kittens, and it's just an outdoor cat, why would you let kittens to come out and suffer that much? Why would you let them suffer that much? So I asked myself that kind of question. The other aspect is where maybe the mother is so skinny or too old, and we actually suspect that when these kittens come, the mother might not even be able to cater for them. Even the process of giving birth might not even be successful. So most of these kittens will die in the preparatorian period. That is between time of birth and day 4, day 5, when they are still not even able to regulate their temperature. Mother doesn't have enough milk for them. The mother is probably very sickly, and the process of giving birth, she's lost so much fluid. She's so dehydrated and drained, no support, nobody can step in to help her. We look at all those sufferings, and then we say with the owner, if the owner agrees, then on my side as a vet, I look at the animal welfare, I say, let's do the spay. Again, we look at the stage of the pregnancy. If it's still early and maybe the mother is still in good health, go ahead and do the surgery. If you think is a little bit late, you can assess that this pregnancy is more than 1 month, then let the mother have the kittens.
Okay, I guess it's a very tough decision sometimes to make. So we've talked about spay and neuter. We've heard about alternative procedures and specifically vasectomies for male animals. Is this possible, and what do you think about them?
Yes, vasectomy is possible. What we look at is why do we normally do castration? Is it just to control reproduction, or are there any other advantages that come with castration other than just reproduction? So if somebody who is a good responsible owner and can take good care of their dog, they will go for the vasectomy because they want the dominant male to be still behave like it's intact. So they'll keep the hormones, but they'll terminate the reproductive ability. So they go for the vasectomy. It's possible, it can be done. I think I've done 1 or 2 procedures. We've had a few clients on request who insist on having their dogs done vasectomy. Then when they get to 3 years, they can now go ahead and do the castration. So the alternative method for males is just vasectomy and nothing else. Nothing else is humane enough to be qualified as an alternative method. You cannot put a rubber band on a dog's scrotum. It's just traumatic. We've ended up doing a scrotal ablation, something that is is more painful, is more involving. The dog has to stay with an open wound for some time before you can actually go ahead and close. And most of the time when you close these wounds, within 1 week, you have it breaking apart because the area is so tight because you have to remove the entire scrotum based on the position on where the rubber band was put. So I think the only alternative to castration is vasectomy. But vasectomy is more costly. And the vets who have done it, I think it is more involving than the normal castration to go for. So if somebody is willing to pay, kindly go for castration, and I think your dog will just be fine with castration. The vasectomy leaves your dog with the hormones intact, and all those that you expose the dog to equal amount of suffering. The dog will be going out there to fight with the others, fight for the ladies. Meanwhile, it can't sire puppies, so it's just going there for his hormone and also to just to satisfy his urges. But in the process, it will be fighting like an entire dog. It comes back home, is injured, 2 weeks been away, is not eaten. You don't know if it has interacted with a rabid dog out there. So just do castration, you forget about the stress.
Okay, so there's also what we know as ruminant castration methods. Would you expound on that? Ruminant castration methods.
Ruminant.
So this is where,
method.
yeah. And so where people use the rubber bands, they crush the testicles and things like that. What are we advocating for animals when it comes to that?
You see, these are procedures done in places where people cannot access veterinary services. Either the veterinary service is absolutely not there, or the vets who are there concentrate on livestock and cannot help the dogs. And if they want to help the dogs, they don't have the right instruments, the right anesthetics to do the procedures. So they opt to do what they do with the large animals. Like people use a badizo in cattle. And they think if they use a rubber band or if they use a manila or a nylon, it can help do the castration. Basically, what they're targeting is to cut off the spermatic cord with the skin intact. So they will tie it. But what we've seen is that sometimes when you do these procedures, because of experience, we've seen a lot of dogs with the nylon around their testicle. The nylon will cut the skin, get to the spermatic cord, will not cut it completely, will cut a bit of it. So if it cut the vas deferens, then it stops the reproductive ability. But most of the time, it will just get to the spermatic cord, the muscle, and hold there. Then the skin will heal around this nylon. So the nylon is tucked into the skin. And this dog will have a lifelong how do you call it? Sinus tract that keep on discharging and discharging and discharging, and this dog is licking itself until one day maybe a campaign comes around and the owners are able to bring it and tell you, Dr. It's idea this dog, we did this and it's been undergoing this. Then you realize probably the scrotum, the testicles died, and they form a very, how do I put it? Like a fibrous mass in there. So
a foreign body.
So the scrotum, the testicle is not actually dead, it's still active, but is not in its healthy state. So this dog is trying to get rid of this, but is not able to. Again, if you look at the suffering the dog goes through with the manila and the rubber band on its testicles, it's basically not an alternative to castration. Is suffering. The dog is suffering. This dog will have lost so much weight. It's constantly having infection in its scrotum that it lives with. And I don't think it's fair. You cannot quantify that as a ruminant castration, and you qualify it to be done for dogs.
Okay. Okay, so thank you for that explanation. We had touched on the use of contraceptives. So I just wanted us, because we've seen so many cases where people have used contraceptives, and of course, the procedures have either failed or brought on further complications. I wanted you to explain to us what exactly is done for these animals, what kind of injections these are that are being given, and what emerging issues occur, especially what we call pyometra. So if you could explain what exactly pyometra is in detail and how it's corrected.
Okay, before I get to pyometra, I'll talk about the injection.
Yeah.
So the injection people think is a shortcut. Like today I was at the University of Nairobi for a procedure, and there's a lady who walked in with 2 cats that they want them to be injected. Good thing the guy who was there managed to convince them very quickly that the injection doesn't work and it's risking the cats, and they agreed to do the spay, which I think was a very good thing. So this injection that we use is a shortcut. Yeah, is used by mostly vets who are unable to do the surgery, the spay. So they take the shorter route to tell the client they can do an injection that will control birth in the cat. Now, just like any trial and error, some instances it works and no side effect, and people can argue on your face that we've given our cat or our dog the injection for over 6 years, we don't see any problem. Yeah, but there's that one time when they will fail to time the hormones, and that is the time that you will see the problem with this injection, because it's a hormone. When you inject it, what it does is that it stops folliculogenesis. It arrests the process of the cycle. such that at the time when the dog is supposed to be on heat, that time lapse, then the cycle may start again, and you expect that in the middle of the next cycle, you come back and do another injection. So most people get advice from friends that no, the spay is very expensive. We have this vet who does for us the injection. And these are people who have had their cats or their dog give birth, and they know the burden of raising puppies. And then they're stuck with the puppies and the kittens. They don't have anywhere to give them to. So they say, before this mom gets pregnant again, let's sort it out. And the nearest alternative that they look for is injection, because they think is cheap. But if you look at the long-term effect of this injection, other than the instant effect, is the pyometra or mummified puppies or macerated puppies. What that means is that the injection is given when the dog cycle is already on. So when the injection is given, the cervix quickly closes, and it disrupts the cycle. So the cervix closes, and with all the procedure of the cycle, the discharges, I mean, I don't mean the discharges, like the reproductive tract is open, so it's exposed to all manner of dirt. And when the cervix closes with all this dirt inside, that's what results into the infection. So when this injection is given and the cycle is not timed, that will happen and your dog will get pyometra. If the cat or the dog is already bred and it's more than 2 or 3 weeks, meaning the pregnancy has occurred, the kittens are already implanted, or the puppies are already implanted, and the development is going on, then the injection is given. The next thing is that these kittens or puppies will die immediately. When they die, the cervix is closed, they can't come out. So they are locked in there, then the uterus get infected and attack from the body immunity, because the body is trying to get rid of whatever is in the foreign is in the uterus. So the kittens will die. If they die and the uterus remains sterile, then the kittens will be mummified. If they die and there's infection, then they will be macerated, meaning they'll rot in there. And by the time you're doing a surgery to save this animal, you'll only find bones. We've encountered a lot of that in our campaigns. So one, there's risk of the pyometra and the kittens dying in there. Secondly, it tampers with the dog's or the cat's normal cycle. So if it's a dog that you want its future reproductive life, doing this injection is not very safe for your dog. If you are a breeder, I think you should have an isolation kennel where a dog that comes on heat and you don't want it to breed, you can lock it there. Contrary to cats, if you have males around, you definitely will not notice when they're on heat. You will not notice. Okay. Yeah, maybe somebody will tell you, we've seen the cats mating, and you see by then it's too late. But when they start coming to heat, you will not notice. So spay your animals to save their life and also to save their reproductive health, so that they don't encounter these diseases like pyometra and also ovarian cancers. Mm-hmm. So when we come to pyometra specifically, pyometra is I would say the term pyometra is it just simply means pass in the uterus, but the scientific term is the more of an inflammation of the uterus that leads to influx in white cells and increase in the bacterial load in the uterus, so that you have pus accumulating in the uterus. What we call cystic endometritis. So pyometra in layman's language is pus in the uterus. So what will cause pus in the uterus? One, if the breeding took place and there was contamination and bacteria was closed in there with the conception, then the process of infection carry on, and then the dog get infection, it becomes septic, then the sepsis goes systemic, meaning the infection comes from the uterus to the general body system, and that's when the dog starts showing signs. I think 60 to 70% of pyometra cases will be open, meaning the dog or the cat will be discharging. So for cats, they keep cleaning themselves and you might not notice. For dogs, they're a bit lazy. So when it's lying down, you'll find a puddle, maybe of pus, or when it's walking, you see actually pus dripping or staining the tail, mostly staining the tail. You will find the tail is matted. So anytime you see your dog, the tail is matted, just go back there and check. Or if you can't see anything, don't ignore. A matted tail is very, very specific. We'll show you that the dog has, even if it's diarrhea, they cannot control it. But if you see it for a female, take that dog to the vet for examination. Another symptom of pyometra, that's the obvious sign that people will see. My dog is discharging from the back, or my cat is cleaning herself too much, there's a problem. The other symptom is that this dog will be drinking too much water and peeing a lot, what we call polydipsia, polyuria. That's also another symptom that you'll notice. It's also with the cats, you'll notice it. Something else is this dog will start showing now sick dog syndrome or a sick cat syndrome, going off food, becoming feverish, just lethargic, doesn't want to move, and eventually they get terminal, and if you're not attended to, this dog will die. So a dog can live with pyometra for quite long as the immunity of the body can take care of the infection. They get to a state where it's just a little bit of discharge coming out, and the dog is cleaning itself, and the body is fighting the infection. So most dogs will come down and show illness, but there are those few dogs that are very strong and will live with it, even for a period of 2-3 months. But if the owner is keen and is inspecting their dog, they should be able to notice an open pyometra within 3 days or even 2 days, because the dog feels very uncomfortable, keep cleaning itself, but you see the matting of the tail. For the cat, cats can also live with the pyometra for quite some time, especially the cases where we have seen the mummified, the macerated kittens and mummified kittens. They will tell you the cat has been cleaning itself for over a year, yeah, and they've never bothered to take it to a vet to check, or to call a vet to check the cat. Something else they'll tell you is that the cat has tremendously lost weight, and sometimes is unable to eat, sometimes it eats. So these are few selected cases where the body immunity is strong enough to cope up with the infection and live with it, yeah. But if you look at the damage that this condition does to the animal become very septic. In case of any slight infection, there's that infection that will now take it down. Sometimes, like for dogs, you find the septicemia has gone beyond that. When you do the surgery, you actually do the operation, and your spay wound doesn't heal. It gets infected in 2 days. So you really need to have a very strong antibiotic to also encounter the infection that is already going on in the body. And that's why we tell people the pyometra is not just a simple condition that you want your dog to encounter. Yeah, sometimes it comes with a lot of side effects. Like some cases we've tried to treat medically, and we've been successful. Others we treat medically, but now the long-term effect, you find the kidneys have been involved, and also the musculoskeleton. There are dogs that get paralyzed on the hind legs, and now you can't even correlate the symptoms, how everything is happening. But you find that the septicemia went beyond your control. The antibiotics that you are using maybe were not strong enough to save this dog. So even after the surgery, the dog is still at risk until it's able to heal properly and get back to its normal life. So as vets, when we come across pyometra, we insist on doing the surgery immediately, because when you report this case that my dog is having this condition, then we diagnose pyometra, maybe physically by examining the animal, or if there's that aspect of doubt and we're not sure, maybe a case of a closed pyometra, we take it for a radiograph. X-rays will quickly pick for you pyometra, and you'll see the uterus, and also you'll be able to visualize that there's pus inside this uterus. So when your vet tell you they suspect this is a case of pyometra, don't doubt them. Give them the room to try and save the dog, because it's a matter of time. If you take too much time still beginning, I don't have the money, let me get the funds before we can do anything, you are only pushing your dog off the cliff. And sometimes by the time you are ready to do the surgery, the vet will do the operation, but maybe the dog will not come out of that operation. So build a relationship with your vet such that they're able to sort you out, even if money is not the issue. Yeah. They're able to sort you out when you are financially down or when you have the money. So build that relationship with your vet. They make a diagnosis, they start the treatment immediately. Finances should not be the reason why you want an animal that is as a life-threatening condition to wait. If they see the dog as an active discharge or the cat as an active discharge, please give them the go-ahead to do the surgery as soon as they can. Organize the finances and sort them when within the time that you agree with him. If he's a first-time client, if you're a first-time client to a vet, most of us have gone through what I would say hell with following up on payment to the client, because from our oath of operation to protect the animals and also to take care of their welfare, I have a compulsive disorder to sort you out even if you are not going to pay me immediately. But the journey you take me through after I've sorted you out is what determine how my colleague or my friend will help you next time. Because we have a small network. Vets, we have a very small network. We have association that protect us, we have a board that protect us. So if you mistreat one vet and you think you can move on to the next vet, is a small circle, is a very small circle. Next time you're turned down, look at your history. What did you do to the other vet that make you be turned down by another vet? Because all vets are they are equal, they're trained equally, they have the animal welfare at heart, and they take oath of office to protect these animals. So even if you call somebody at 4 a.m. to come and sort your animal, they will do it, yeah? But do your share of the bargain, sort them out.
Yeah.
So Pyometra is as an emergency, as I'm putting it, yeah? Is a condition that is just very close to kidney failure. I think more than a heart failure. Heart failure may be slightly far from kidney failure compared to pyometra. But your cat's kidney circulation is continuous with the uterus circulation. So any infection in the uterus can easily ascend to the kidney like a snap of a finger. So if your vet tells you a cat has pyometra, let them sort the cat immediately. Or if they tell you a dog has pyometra, let them sort the dog immediately. If you have a very high priced dog that you want to breed in the future, the vet can also save the breeding life of the animal from pyometra. It has been done, and sometimes we do it with antibiotics. It sorts the dog, and in the next season, you must breed this dog. If this dog comes to hit, you must breed it. If you don't breed it, it's going to come down with pyometra again, because now the body work on I would say humoral response. So next time this dog comes to heat and the uterus has all the discharges to clear before the cycle resume, the body will quickly pick that as a new infection. Then the influx of white cells and then the cervix closes and then everything is retained there, then the pyometra recurs. So if your dog is treated from pyometra and is a dog that you intend to breed from, breed it in the next heat. Yeah, breed it in the next heat. If you don't intend to breed from that dog, don't take the medical direction. Don't take the medical direction. Let the vet do the spay, sort out the issue permanently, and the dog live happily thereafter.
Okay, thank you. Wow, that was quite informative. I hope people will take the use of contraceptives more seriously and avoid them as much as possible. Now, as we jump into our second last segment, the responsibilities as a pet owner is in terms of getting a spay and neuter. So what are the questions that maybe you should be asking your vet about the surgery, and what post-operative care should we expect? If we can just go through that briefly.
The responsibility of a pet owner. Once you make a decision to have your animal spayed or to have your dog castrated, you want to use a reputable vet. I'm not saying your vet is not reputable. If he's a vet you've had for long, you know their capabilities, you know their practice time, and you know their history. It's not very rude to ask a vet if they've ever done a spay before and how many have they done and what is the success story. It's not rude. Yeah, we take it very politely, and I take that opportunity to brag about my experience. I'll tell you what I've done, what challenges I've encountered, and what are the possibilities. Yeah. So once you ask the vet their background and their experience doing such kind of surgery, you want to know where is it going to be done. Most vets want to do spay at a clinic where they have everything in case of an emergency. Experienced vets can suggest, like, maybe your place is in Naivasha. Why would I come to Naivasha, pick the cat, come to Nairobi, do it in Nairobi, bring it back to Naivasha? Probably the cost of coming to Naivasha and back might be the same as the cost of doing the spay. So if you have a safe place at home where an experienced vet can quickly make a field station for a surgery, they would rather do it from home. And this depends on you as the client, if you're comfortable with that, the population of people in your house, the nature of your house, and the nature of where they're going to do the surgery. If there's too much involvement, it's not safe for the surgery because contamination can still take place. Something else you want to ask about is how long is the procedure going to take? Established clinics would prefer that you bring the cat a day before. What the advantage of this is, it gives the vet time to monitor and examine your pet properly, especially a dog or a cat. Sometimes a dog leaves the condition, or your cat leaves the condition that yourself you've never ever noticed. And here you're putting an animal under anesthesia, and that nobody has that history, nobody has that information. You inject the anesthesia, then the dog is dying or the cat is dying because there's an underlying condition that neither you or the vet knows. So if they have the comfort of time, they would take the animal to the clinic, spend a night, they do the operation the following day, it spend another night, then they bring it the day after when the cat or the dog is awake and the anesthesia has worn off, and the cat is in hands of responsible people who can actually monitor the anesthesia, know when the cat has woken up, they give you an update, the surgery was well and the cat has woken up. They take care of the food withdrawal period, because sometimes we insist, do not feed your cat. I'll explain that in a bit. But the cat is an outdoor, so you have denied the cat food, the cat is hungry, he's gone to the neighbor, he has a full stomach. Then 10 o'clock, you're at the vet, anesthesia, the cat starts vomiting. So that's a risk. And sometimes taking the cat to the clinic a night before saves you that expense. Most vets will not charge you a boarding cost for the night before the surgery or the night after the surgery if they have to keep the animal. If it depends on the vet, it's not a rule of the thumb. Every vet have their mode of operation, have the way they levy their fees. And if they're charging you for that, it's for your safety. So I don't think it's really something that you should be worried about, that they're charging you for one day to stay. Maybe the person who will stay with the animal after the surgery overnight will be paid. Yeah. And that's the fee they're transferring to the owner. So sometimes you discuss these things with your vet before you actually make a decision. So if your vet tells you, we are picking the cat today, we skip it overnight and we're doing the surgery tomorrow, then we bring it the day after when the cat is awake and everything is fine. If they levy for you a fee for the 2 nights that they're staying with the cat, don't change your mind. Just talk to them. Just argue out. We are all human. You can say, okay, doc, let's share the cost. I'll take care of 1 night, you take care of 1 night. I don't think there's any vet who will refuse that. So if a vet have the luxury of bringing the cat to the clinic, let them go with it. If you want the cat to be done at your place, you must be very, very careful and be very inquisitive why the vet want to do the surgery at your place. The advantages must override the disadvantages. Yeah, that you have a safe place, you have an extra room with a good table and is free from a lot of human movement, and nobody will be coming around to take videos or pictures when the vet is doing the surgery, because not all vets are used to on-camera surgery. Not all vets are used to doing surgery when everyone is watching. Sometimes your presence might make the vet not even get the uterus of the cat. Yeah, It has happened to me in an interview with my experience. I could not get the uterus because the bosses were there. The people who were interviewing me were there. Yeah. So I asked twice, has this cat been spayed? They said this cat was born here, it's never been spayed. So that gave me the confidence to go ahead and look for the uterus. Story for another day. But your presence in the room might affect the vet doing the surgery. So once you allow the vet to do surgery from home, let them have their space and a clean room, safe for surgery, then they'll do the surgery and complete it. Something else you want to ask for is the cost of doing the surgery. You must agree on the cost. Don't take your cat, throw it at the vet goes with the cat, do the surgery, they bring it back, then they give you an invoice, then tantrums come in. This is too expensive, it's not what I budgeted for. So know the cost of doing the spay before even you start organizing for the cat to be operated, so that you're comfortable with the cost that your vet is going to give you, and you agree, and most vets will make you sign a consent form. A consent form is not to trap you, yeah, but is from the experience that vets have had with clients. So if I come to you today and you're giving me your cat to do a spay and I give you a consent form to sign, is not to trap you that I'm going to kill your animal, then you cannot take me anywhere. No, 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 no. The veterinary board is still open. If you are aggrieved, walk into the veterinary board, your issue will be sorted. So if I give you a consent form to sign, read it, read every word, know what it entails, know what the vet require of you that is included in the write-up, and sign what you understand. Yeah. If you don't understand, keep the form with you, take 1 or 2 days, consult with somebody who has had experience with vets and know what that entails. Some people send this consent form to their lawyers, and a lawyer will find a lot of loopholes in a vet's consent form, because we draft the consent form to suit our practice and also to suit the animal welfare, and also to suit the veterinary ethics and code of ethics and mode of operation. So sometimes you take it to a lawyer and they'll tell you, no, 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 this thing is not good. Don't go to that vet. Then you go to a second vet, it's the same thing. A third vet, then you can't trust any vet. But it's good to also even seek a second opinion from maybe another vet to tell them, what do you understand from this consent form? You may not need to tell them what operation you want to do. You just tell them, check out for this consent form. What does it entail? Because anesthesia can go either way. Yeah. We've done a lot of CPDs, we've been in school, but sometimes we still lose animal anesthesia. And it might be the underlying cause that I was talking about that we all fail to notice before the surgery. Yeah. Vets are very honest. They will come quickly and tell you this animal died because of this situation. It might be because of anesthesia. Anesthesia may kill an animal if the animal is not competent enough to take the anesthesia, meaning it has circulatory issues, it has respiratory issues, or the system just can't break down the anesthesia properly. So that will risk the life of the animal. So as a vet, like for my case, if I'm taking an animal to do surgery on the same day, there are a few questions I'll also ask you. I'll ask you the last 2 weeks, how the cat has been behaving, how the dog has been behaving, has the dog been eating properly, activity and everything, any treatment in the last 3 months, any medication in the last 2 weeks or 3 months, what type of medication, is this dog on any heart medication, is this dog on any supplements? So there are a lot of questions that come in, and it's not because the vet doubt you, but you just want to be sure that when I'm putting anesthetic on this animal, the animal system should be competent enough to take the anesthesia, take the surgery, and come out of the anesthesia and heal well. Yeah, because what we see as most sudden death as soon as you inject the anesthesia is either a compromised heart or a compromised respiratory system. Those are the situations that will suddenly make you lose an animal. But we also have our resuscitation techniques. We have a reversal. We have ways of bringing back these animals out of the anesthesia very quickly so that you can stable the heart. If this is happening mid-surgery, we break the surgery and save the animal's life, even if it means losing back the animal. You have to save the animal. Something else is your area where you come from. Is it prone to ticks? Is it prone to fleas? If this dog is having an underlying tick fever, it's going to be a nightmare to the vet because of the bleeding. So if this dog has been on tick fever treatment, it's safe that the owner declare that my dog is under this particular treatment. Yeah. A good vet might want to take some more samples, may want to take some more blood to be sure before they put this dog under anesthesia or before they actually open up this animal. So if a dog is operated and it dies of bleeding, sometimes this dog had an underlying condition that compromised the clotting of blood. Because you can tie all the sutures that you want to tie, you ligate everything that you want to ligate, but the capillaries remain actively bleeding. So this dog is bleeding passively and may die even 3 days after the surgery. So at that level, you might not be able to associate it with the surgery, but surgery is the number one culprit because the dog was fine, then it was operated, it's dead. So surgery becomes the first exhibit. You will point out that, no, my dog was fine before the surgery. So if you don't declare this to your vet, then they don't know. They are not angels. So they will go ahead and do operation at a dog that is very, very risky. Then your dog dies. Then you lose faith in vets. You call this vet, and it changes life for everyone. Nobody wants to deal with such kind of client. And yourself, you would also not want to have another pet because of that kind of traumatic experience. Yeah, maybe this is a companion animal for a condition and you lose it to a vet. It's not going to go down well. So let's declare all this to the vet before we actually let our dog go for the surgery. Something else the clients would want to ask is how long is it going to take, the surgery going to take? Depending with the surgeon, their allowance time mostly is between 1 hour to 1 hour 30 minutes. But with the experience and doing this again and again, record time varies with the vet. So vet, I don't think a vet will tell you I'm able to do a spay in 15 minutes, even if they're able to. There are vets who are able to do it in that time, but they will tell you the maximum time. It takes about 1.5 hours or 2 hours, yeah, so that they can take their time as much as possible to do the right job and also to safeguard the animal, yeah. Because you say, oh, if it's 15 minutes, then I can come with the dog to the clinic and just wait, yeah. You do the operation, then I take the dog home. Never. It's not that safe. It's not that walk in the park. You will open up an animal, then inside you find very different things that now slows you down. You need an assistant. You have somebody to hold the dog, like hold for you the tissues because they are very fragile. And all this determine the time you take to do an operation. So if a vet tells you it's going to take 20, 30 minutes, just give him the dog, tell him to go with it, bring it home when it's fine. So they may bring it home the same day or the following day, depending on how the surgery goes. So the third question will definitely be, how long will the dog take to heal? A normal spay will heal in 14 days, yeah? Even after those 14 days, the incision site is still very, very fragile. Anything can happen. This dog can jump over a fence, just get a small scratch on the skin, and then the wound comes back again, yeah? Because even if a wound heals, an area with a scar doesn't have the same integrity like an intact skin. Yeah, they're never the same. So the healing process will start immediately the dog is closed. Or even when you cut, as soon as you cut, the animal is bleeding, the healing starts there and there. But for a spay, as soon as the dog is closed, the healing starts immediately. So with the antibiotic and painkiller, those ones take care of the dog, but the wound will heal naturally within 14 days. So if the dog is an outside and freely roaming dog, you're looking at keeping in this dog for that period of time. You don't want it to go and interact with other dogs. You don't want it to go and jump over anything because the stitches are still there. Any jump means the body is stretching, so the stitches may just get loose and get cut. And dogs don't know wounds. When a dog sees a wound, it's time to continue destroying it. They will be curious. They don't want to know what is in there. They will pull out all those stitches, pull out the intestines, pull out the spleen. If they can access the liver, they'll pull it out. And then you lose the dog. So if the dog is brought back to you after the surgery, they give it an Elizabethan collar. The Elizabethan collar is Most of them are made of plastic, but we've seen some that are made of nylon, and they are flexible, so it doesn't restrain the dog too much if it's a freely roaming dog. Keep the cone on as long as your vet advises. If the vet advises 2 weeks, please keep it for 2 weeks. If the vet add another 1 week, please keep it on. The stress of repeating the surgery and the cost, and also the stress of having another injury to the dog while repeating the surgery with infection, is more than the stress of this dog having this cone for just 1 extra week or extra 10 days, or even for 1 month, depending on the judgment of the vet. Just listen to them. It's okay to be empathetic to your dog and sympathize with her or your cat, but just listen to your vet. It won't cost you much. 1 minute, I turn on the light.
Okay. And for anyone who has questions, you can, in the meantime, you can post your questions in the chat.
Yeah. So if your vet advises you that the cone stays on for a month, let it stay for a month. They know why. They look at the integrity of the wound and they advise you accordingly. We have the advantage of being able to send images electronically. You can send your vet a picture of the wound, then they can quickly tell you, remove the cone, let the dog free. Yeah, that can even happen as early as 10 days. Yeah, because from my experiences that I check on my patients every 5 days to see how they are progressing. It's something that we've talked about with other vets. Experienced vets do that as well. Unless it is very far, a place like Samburu, I can't go back there, then we have the advantage of WhatsApp. You just tell the guy, send me a picture of the wound, then we assess. Then we know when to remove the cone or when to keep it on. Something else is that you want to ask your vet, in case there is a reaction, in case the wound reacts to the sutures, what should I do? Should I dress the wound? Should I bring the dog back? Or what happens? A good practice is that do not do anything to the wound. Do not do anything to the wound. Unless the wound is actively bleeding, then, sorry. You want to find a way of controlling this bleeding before the vet can arrive or before you get to the vet. So you can tie a bandage. Yeah, you can take maybe a lasso and just wrap it around the dog. If the bleeding is active and is actually coming from the abdomen, you want to retain that fluid as much as possible so that you get to the vet or the vet get to the dog when the dog is not too much, has not bled too much or has not lost so much fluid. The reason I'm saying do not do anything to this wound is actually sometimes you think you are helping, but you are actually damaging or risking the life of the dog. Yeah, like a wound that is over 3 days or 4 days, you wouldn't want to clean it with surgical spirit, even if you have the methylated spirit at home. You don't want to, because there are some good healing tissue that is already there. If you put spirit on that, you are going to destroy them. So we advise that you don't do anything to the wound. If you send a picture to your vet and the vet think the wound is safe enough for you to dress from home, they will give you an advice on what to do, what antiseptic to use while dressing the wound, or what exactly you need to do to dress the wound. But my best practice is that if a wound has a problem, if a wound has reacted, I need to see the wound myself. Yeah. Try as much as possible that the surgeon who did the operation is the same one who see your animal when they react, because they know how they did the operation, they know how they closed the dog, they know which layers they close together with which one, so that if your dog reacts, sometimes they don't have to open up the dog. They just need to dress it the way it is and give you instruction on what to do. And sometimes they don't even have to close the wound when it reacts. They tell you this one will heal as an open wound. Don't tamper with it. Give it time. The healing time will now move from 2 weeks to a date that I will tell you as the wound progresses. Yeah. But if you can't access your vet and the wound has reacted, when you go to the next vet or an emergency vet, it's good to declare, is Desmond who did the surgery? Is this other vet who did the surgery? So that they can talk. It's not any secret. You're not hiding anything. After all, I will call my colleague, hey, your case came to me by now, this happened, so we sorted it out. So you were hiding your vet that you've come to me, but I'm the one who will tell the vet that you came to me. So it's good to tell the new vet that this is the other vet who did the operation. The reason why I'm not going back to him is because of A, B, C, D. And let's pick the case, let's continue. Even the veterinary board requires that if a vet comes to you for second opinion, you must seek the permission of the previous vet to treat the animal. Is ethical, yeah? Other than getting the right history, the right treatment that was given, it's ethical that you tell the previous vet that now I'm handling your case with your permission, yeah? So okay. If your dog reacts, try as much as possible that the vet who did the surgery see the dog. If you can't access them, then you're moving to another vet. If you're not satisfied with them and you're moving to the other vet, declare to the other vet that this is the vet who did the surgery. Yeah, and it's good to tell the reason why you're moving on. Yeah. So once your dog has healed and you've taken away the cone, you would also want to know what are the side effects are you likely to see on your dog? What are the long-term effects of the surgery? What else can we see? And sometimes your spayed dog or cat may come to heat after 3-4 months. Yeah. So from my experience is that I would not rush to reopen that animal. I would give it time. I would tell you, let this heat pass. Then let's see if the dog come back, the dog or the cat come back to heat again. Yeah. So the client would be worried. What if it gets kittens? Yeah. Because sometimes when we do the operation, the hormones are already onset. Yeah, the cycle is already on. So you're doing the surgery mid-cycle. So the hormones that are already on the system, the ones that we were not able to eliminate with the ovaries, continue to stimulate the body, and the cat may show that he's still on heat, or most of the time a piece of ovary is left in there and is still showing the surgery. The sad part is that there are cats that have been put through the knife and the uterus has not been touched. It's entire as it is. And there are cats that have given birth when they have the surgical wound, even the fur has not grown back properly. And you find this cat has given birth. So that's dishonesty on the part of the vet. If for any reason a vet cannot complete the surgery, they need to declare to the client that we were unable to complete the surgery because one, like my case, you could not find the uterus and you didn't have a second opinion immediately. So instead of keeping the cat under anesthesia for long, you opted to close. So the client can seek a second opinion elsewhere. It's good to be honest. Two, when they remove one ovary and one horn of the uterus, they could not find the other one. Yeah. So that's competency. So it happens. We've done this surgery. If I could share a picture on my screen, I would show you, but story for another day. So sometimes the dog will come to heat after the operation. It's good to see if this heat will pass or if the second heat will come back. If the second heat comes back, then definitely there are tissues of ovary that are left in there, or the ovaries are intact in there and they're still producing hormones. So it's advisable this cat undergo another operation, find the pieces of the ovaries. From experience, they're easy to find and just remove them. Yeah. Just remove them. So I think I've sorted the possible questions. The other questions, when you feel anything that I've not covered, you can post it on the chat box. Then we can answer them as we are going on.
Okay. So one of the things we really try to do is to manage stray colonies, and this is through spay and neuter. If you can just take maybe 2 minutes quickly to tell us why then it's important to continue doing the spay and neuters for the stray colonies and what we can do to help these cats and dogs.
Thank you. It's good to refer to these dogs or cats as stray, but the story starts from somewhere. These dogs start their lives from someone's home where they are kept easily and they are fed and they are kept nicely until the puppies start to come, or for the cats until the kittens start to come. Then previously you had one cat that you really loved and you were taking good care of it. but now it's given birth to 4 kittens, of which maybe 3 are females, 1 is a male, very quickly growing. When they turn 6 months, the breeding start again. So you will realize in 1.5 years, you had only 1 cat, but now you have 4 cats that may all be pregnant. And even the mom may have also been pregnant in between here again before it catches up with, the kittens catch up with her, so that they're giving birth together. So that's how stray colonies come about. Yeah. Secondly, what brings in stray colonies is poor disposal of waste. Yeah. If the waste is not properly disposed, then these stray dogs and cats have food. If you look at your estate, you go to your dustbin, your dumping area, you will find 1 or 2 cats there. Anytime, you will find 1 or 2 cats there. If you go in the morning, like around 7, when most people come and dump their waste, you'll find there are many, because they know this is the time food is coming from the houses. So stray dogs emerge because of 1, people who don't control their pets breeding, and 2, poor disposal of waste. A waste will attract dogs from a neighboring community. If the dumping site in the neighboring community is not as busy as your dumping site, the strays in that area will come and invade. They will fight for food. Dogs fight for food, for survival, and they also fight for breeding rights. So they will come, fight. If they win the fight, then they take over. So those that were there will remain, and these new ones will also now colonize the place. The older dogs will find a way of coping up with them. If they don't win the fight, then they devise a survival tactic. Probably the 2-3 cats that you're seeing during the day are the weaklings that cannot face off with the strong ones who come to feed in the morning. So they feed, then go back to their hidings. Yeah. And apartments provide a very good place for stray cats, because at night, like now, is very, very cold. But all the cars come back. The cars are nicely warm, and they stay under the car. As the cold catching up with them, they even go up the engine. Yeah. Then they know around 5, 6 in the morning, the cars start moving out, they leave. So that's how they live, and that's how they survive. So strays come because of human irresponsibility. They don't come from nowhere. They don't come from like human. We know our generation. Maybe we were born of Adam, or God created us. But the strays in our communities, they come from irresponsible animal ownership. If you don't spay your cat, if you don't spay your dog, and each year they give birth, when the puppies are about 2 months, you see them disappearing. Maybe you think children are picking them up, so you're not worried. But trust me, the mom leads these puppies away to the dumping site, then she disappears. She literally runs away from them and come back home, because she's sure they'll not know their way back home. And that's how they colonize the streets. All right, so we've known the source of the stray dogs. So number 2, the main reason why it is important to control these strays is that you don't want to be overwhelmed. You don't want to have dogs that even the community dumping site cannot sustain. Because dogs, when they are hungry, they will do anything to have a meal, including invading people in their homes, or even right in their houses. And that's how we end up with the dogs that are harassing people in the society. And the victims, as I said earlier, are usually the children. So you might find one dog is just harassing everyone. Maybe it is the leader of the pack, and is trying to get food for his followers. So he will do anything to get the food. Yeah. And that's how the dogs invade the society, and people start complaining. We have been invaded by stray dogs. We cannot control them. They're attacking people. They're biting people. But those are biting people because they're hungry. There's no food. So they're looking for food. And probably the punishment is coming back to human, because it's human irresponsibility that led to the stray dogs mushrooming in the societies. Now, when you move now to controlling the stray population, is still a very, very difficult situation. We do our best. The SPCA is doing their best, but we still can't find a balance. So our target is that if we find the males and castrate them, if we find females that we can catch and spay them, yeah, at least we reduce the chances of having more puppies in the next phase. And is not proven. There's no write-up to back it. But stray dogs have a short lifespan. Yeah, their lifespan is maybe between 3 to 4 years. If you find a stray dog that lives on the street up to 5, 7 years, it must really be polite. It's feeding from one specific place. It knows how to cross the road. It has mastered how to cross the road. And the people around there are very friendly to it. So it will come, lie under the car or lie somewhere near a butcher, or there's a butcher who feeds it from his butchery, or there's a hotel somewhere where they feed, or there's a street boy who go and forage for food and bring to this particular dog. But stray dogs that lead this typical street life, their lifespan is very short. Either they are hit by cars, or through the fight, they get infections and they just die, or a virus just strikes and the dogs are dying. So that lifespan, keep it short. So if we manage to spay these dogs and also castrate the few that are there, one thing, they control the population of the dumping site. They don't allow new dogs to come in. Yes. And some that are very socialized will find new homes. A dog will just walk into a home. We've seen so many dogs, a stray dog, a dog that is over 4 or 5 years, walking into a home, doesn't want to go away. You start feeding it, it becomes a home dog, meaning it's tired of that street life. Yeah. So if we take care of the females that are there, we do the spay and neuter, then we don't see an influx of new puppies every breeding season, And the ones that we've spayed and released back to this environment, they tend to control the population. They fend off other dogs that are trying to invade. So they keep the numbers. And because of the short lifespan on the street, they die naturally and you get rid of them. The best solution would be to handle the waste properly. If you just handle the waste properly, that the place where you do the dumping is built and is lockable. Once you put your trash, you lock it back. Once you put your trash, you lock it back. These dogs will not have access. They will stay there for 2-3 days. They see no food is coming, no food is available for them to feed. They will move. If the neighboring community have a dumping site where they can survive on, they will go eat and come back. But eventually they'll get tired of coming back. So they'll go and find a new colony and stay there. And if they're breeding from there, the new ones that are coming will adapt that area. They will not come back to adapt here. And that's how you will sort the stray dogs. Typical example is there used to be a dumping site on your way to Kabete, just after Kawangware, between Iliri and the estates. There used to be a very huge dumping site there. So the dumping site was moved and there are no more dogs there. Some of them moved back to Kawangware and some of them just moved up way Udiru. But that area, there is no dog that is surviving there. So if you take care of your waste, if you take care of the dumping site properly, then these animals eventually just move away. They move away from the street. But the best is to liaise with the KSPCA and TNR, see how we can do a community fundraising and sort out the strays as we've done with other estates.
All right. I think we've covered most of, the questions we had today. There was a point of clarification. A question came in from Lily. She was asking, when it comes to the failed spay surgeries, is it that the cat has 2 uteruses or what is happening? The cat or dog? When it comes to a failed spay procedure, where you find you have ovarian tissues that are still left there, is it that the cat has 2 uteruses or what exactly is happening? So if you can just clarify that briefly.
No, I think with our experience over 3,000, we've never run into an animal with 2 uteruses. It's possible because of embryological maldevelopments, but it's something we've not encountered. What leads to these situations is incompetence. Like I said before, I wouldn't say negligence, because the vet has intention to remove the uterus and the ovaries, but probably they don't know at what point to cut or at what point to ligate and actually cut. So when they do the ligation and cut, a bit of tissue remain, ovarian tissue or an entire ovary remains still attached to the ligament, yet they've removed the uterus. The scenario where you find one horn of the uterus is removed and the other ovary is also removed, but the other horn is intact entirely with the ovary. Yeah, this is a case where somebody either made an incision up way too high, so they can't find the bifurcation of the uterus, so they cannot be able to trace the other horn amongst the intestines. Because something else we've noticed with the uterus is quite elastic, and the moment you start manipulating it, it's also shrinking, and also that highly depend on your level of anesthesia. If the animal is light or the dog is under light anesthesia, the uterus, the ligaments become very elastic and they pull back. As you're pulling, they pull back. So probably by the time you get off one horn, you can't find the bifurcation and you can't find the other uterus. And the third scenario is where we found that the one horn that was cut, the other horn that was remaining, was actually tied with a nylon. Yeah. So I think this is a vet who had good intention, but just couldn't find the other horn. So they put the nylon maybe to eventually cut this other horn, but they are not solving the situation, because if the ovary is still there, the cat or the dog can still get pregnant. Yeah, it can still get pregnant. The worst is they can still get pyometra from the stump of the cervix that you've left too long. Yeah. So it's not a case of two uteruses. It's just a case of one horn is removed, the other horn is remaining, or both horns are removed, but ovarian tissue is remaining. So the cat or the dog will still show symptoms of cycle because the ovary still produces hormones.
Okay. Another question was, what are some of the myths associated with spay and neuter procedures? And especially you find that it's usually around the fear of the surgery, the fear of the healing time, and the pain that the cat is undergoing. So if you could quickly just go through that.
Okay, the myth usually come from speculation and also the end results. If you bring your cat to me for surgery, then it dies on the table, and I don't give you a proper explanation, then you will easily buy the myth that the cats cannot take anesthesia. Your cat will die on the table. We fight a lot of times with that in the field. The young boys between ages 13 and 15, they run around to spread that rumor that come and see, the dogs are dead on the table, come and see. They show their peers that the dogs that have been put under anesthesia, actually because we do the preparation outside the tent, the shaving and all that, they show them. They even come as close, you think they want to see, but this boy wants to prove to his peers that the dog is dead. Yeah. So that's one thing that will worry people. People will say, my dog will not come out of anesthesia. What anesthetics are they going to use is not safe. So the dog is going to die, the cat is going to die. So that's one myth, that spay lead to death, because maybe the animal dies and the client is not given satisfactory explanation. So when such kind of question come online, my cat went in for spay today and it died. What could be the reason? When you see a client coming online to ask that kind of question, they are not given satisfactory explanation from the vet. Yeah, probably they didn't do a proper postmortem to see what went wrong and prepare the client properly before the anesthesia that this can happen and this cannot happen. And if this happens, the cat dies, it can either be because of ABCD. So the client is prepared, not to scare or to put fear on the client, but just like human. Anytime you take your person for surgery, they are supposed to undergo general anesthesia. You will sign a consent form. And on the consent form, one of the points is that the person might not come off the table. So it doesn't mean the doctor intentionally will kill your dog or your cat, but an accident can happen, an error can happen. But how they explain this error to the client makes a difference. It's good to be honest and tell the client what went wrong so that they don't come online. Online doesn't give you the best answers. Sometimes it gives you what you want to listen to, that the vet was wrong. Yeah. But it doesn't give you the answer why your cat died, why your dog died. And that is the myth that comes in, that animals don't leave the table. Yeah. Some people will tell you should have asked first. Our dog died in this place. We were never told anything. So it's not safe to put dogs on anesthesia. We were told this thing can be done by local anesthetic. Don't put your dog under general anesthesia. But they are not the vets. Yeah, they are not the vets. So if your vet give you a proper explanation, you will not come online and you will not put fear in other people so that they believe anesthesia kill dogs. The other myth is that when males are castrated, they lose their their muscle tone. They become very docile. They become very like they just become, I don't want to say useless dogs, but not as per the expectation of the owner. But the truth is, when the dog is castrated at the right age, the hormonal effect is already there. The hormonal development that is needed has already taken place. So eliminating the hormone does not change the dog very drastically. Like a dog that was aggressive and protective of the owner loses that protection. No, the aggression will come down to a controllable level, but the protection bit of it, this dog will not lose. How you relate with your dog is how it protects you. So the aggression from hormone is actually a vice, yeah? Because sometimes even yourself, you cannot control a dog that is out of hand because of hormones, yeah? So if you do castration and you're able to socialize down this dog, it will work better than if you're trying to socialize a dog that is entire.
Okay.
So the myths, there are so many, but I think those are the ones I can take right now. Or if somebody has a myth they can post, then we can demystify.
There's a question here from someone. Why did I chase the cats away from my screen? I haven't chased them away. They're just around here somewhere. They keep passing in front of my screen. They're playing around. There's a question, and especially to the behavioral issues. Susie is asking, after neutering, one of the cats has become more dominant, beating even the cats that are older and bigger than him. And this is after neutering. Is it a behavioral change because of the neutering, or is it age progression? And also, is it then advisable to rehome him? Did you hear me, Daktari? All right, Dr. Desmond has frozen in place for a bit. Let's wait for him to reconnect. There he is. Okay, he's here. He says hi. He's just here sitting behind me. As I address some other questions, June, you were asking about a cat that has a cleft, I presume, is it a cleft palate or is it a cleft lip? So maybe I would ask that you reach out to me directly, and then we can advise on maybe which vet would be possibly more equipped to handle such a surgery. Dr. Mikali, thank you very much for your comments, saying that we've articulated the presentations well and discussed them well. Steve, on your question about fleas, we'll address it in a different session. Today we just wanted to talk about spay and neuter. I think I've answered everybody's questions so far. So Susie, just wait for Dr. Desmond to come back. Let's see if he can answer your questions in terms of behavior. Or alternatively, is there any vet here who wants to address the question for Susie? I can see a few vets who are tuned in. Anyone who would like to take that question, and I'll unmute you. Dr. Benjamin, let me unmute you. The question is, Susie has a cat who after spay and neuter, after neuter, it's a boy, has become more dominant, beating even the older cats than him. So is it a behavioral issue post neutering, or is it normal? And should she rehome him?
Well, I've seen a few cats that we've neutered, but even before neutering, that trait was already there. So sometimes you get it's a behavioral issue which is not related to the neutering itself per se. Because if we neuter a boy cat, we tentatively want to reduce the hormonal levels. So the testosterone will go down eventually. So it doesn't mean that if it goes down, they'll start being aggressive to other cats or being dominant. So you find it's usually a more of a behavioral thing, not related to the neutering itself. With people who have dogs, we usually advise them to seek a behaviorist so that they can be able to train them or educate them on what they need to do afterwards. But for cats, now that's a difficult topic altogether, because I'm not sure if we have someone who can train cats. I'm not sure, to be honest. I've never encountered one, but it would be something good to try. So I don't think it's related to the neutering itself. But if it gets out of hand where even the owner can't be able to control the aggression between cats, then unfortunately, yes, the kindest thing to do would be to rehome, because you can't be somewhere where the cats are fighting all the time. So you find some cats want to be solitary animals, so they want to be in their own space. They don't want to mix with other cats. So it's best to find a home where that particular dominant cat can be in its own space.
Okay.
I hope I've answered the question.
Yeah. Lillian, Dr. Lillian, I've unmuted you. Maybe you have something to add. I can see Dr. Desmond is coming back.
Hi.
Hi,
and thank you. This is such a lovely presentation. I just wanted to add on to what Dr. Benjamin has said, and also just add some more information. We actually do have a certified animal behavioralist in this country, and her specialty is dealing with companion animals and trying to identify the source of their stress. So if someone wants to actually find a behavioralist, we do have, and I can post her name to you, Naomi, in the chat, with her details in case anybody needs. Now, the other thing, just to add, sometimes you also need to understand that animals have different territories. So I think my question to, is it June? Who
Susie.
asked, Susie, sorry, who mentioned about the aggression would be, has the aggression been noticed during feeding or during interactions? Because if cats have different, they have different zonings even in the home. So you may find that at the point where they're fighting is where there's that overlap of that communal area, and the cat is just trying to be protected. So it may be a behavioral. So trying to reduce the stress that's triggering this conflict, whether it's feeding, and cats will fight during feeding time. You kind of need to separate the different feeding points. You also need to talk, sort of consider watering points as well. And even if it's things like scratching posts or places where they lie, if they're sharing any of that space, that's bound to create conflict. But if the animal is actually deliberately getting out of its way, maybe it was lying down to go and actively attack another animal unprovoked, then that is a point of stress, and finding out why the animal is stressed and what has changed in the environment may be of benefit. But I don't think it's actually related to the castration as well. Thank you.
Okay, let me, so Susie happens to be my sister, and I know the cat that is doing all this work. His name is Tutu. He's a very active, almost 1-year-old rescue, who happens to be a purebred Persian. And we noticed the behavior change in him recently. But he does have, I mean, they have a huge yard to roam in. They have various feeding points, but he does seem to attack, and especially he attacks the older cat, who's not so old, he's under 4 years old. He seems to attack him when they're outside in the garden. He doesn't want, so Tutu attacks Sebastian and doesn't seem to want Sebastian to be around the garden. So maybe it's a point of territory more than anything else. We'll keep observing, and I'll reach out to you about the behavioral contact. We had a question from, from June. She's the one who was asking about the cat with the cleft lip. So June, I will unmute you and then you can expound on what is happening to your cat, and hopefully the vets here can give a recommendation on who to see for this required surgical procedures.
Okay, so my cat has a cleft. It's not a lip. I don't know, the one that's
palate?
like inside.
Palate.
Yeah, palate. Yeah, it has a palate, and we took her to a veterinary, and then a vet, sorry, and then it was stitched, but then after a few days, it kind of opened up again and became even worse than it was. So these days she sneezes when eating. She, like, her feeding has gone low, her appetite is so low. So it's generally affecting all aspects of her health. She's lost weight, and right now we actually sleep like in the same room with her because I kind of want to look at how she is at night. Sometimes her nose blocks. So I think it just comes with a cleft. I'm not sure. This is just my assumption because these are things that came after the surgery. So I haven't been able to visit another vet because I'm skeptical if it's going to become worse because it wasn't as big, but then right now after the surgery, it's now bigger.
Okay. Is there any vet who'd like to address that? Dr. Desmond, do you want to start? Any other one can raise their hand and I'll unmute you.
Can you hear me?
Yes.
Okay. I think cleft palate is a congenital condition, and it should be corrected when the cat is young. But now that the cat has undergone a surgery, I think when the wound opened up, the amount of tissue that was there now reduced. So what is happening is that when this cat is feeding, there is communication between the oral cavity and the nasal cavity. So a bit of food goes into the nasal cavity. And that's, I think, what is causing the sneezing and also the nasal blockage that she's getting. But don't shy away. The sooner you go back to the vet, the faster you will help your cat. So don't shy away. Seek a second opinion. There are several vets on the chat. I wouldn't recommend any vet, but you can consult with Naomi. She'll give you direction on the right vet. And I think something else needs to be done. We need to do an X-ray on that cat to see the extent of the cleft, to see if it's how the nasal cavity is communicating with the oral cavity, how big the cleft is before an intervention is actually made. But don't shy away to go back for second opinion. That cat is not doing good. Can you imagine eating and food is in your nose? So your cat is suffering. The sooner you take it to the vet, the faster you help the cat. And don't shy away. The cat can still be helped.
All right.
Thank you.
Anyone else? Anyone else would like to answer June with a different opinion or additional info? Madaktari, naona mko wengi. Dr. Olum, let me unmute you. Okay, so Julie, Dr. Loom says he's in a noisy place, he can't speak, but I'll share contacts with you. He's at Jacaranda Veterinary Clinic. All right, so thank you. We had one more question. It wasn't about spay and neuter, but it was about flea treatment. So Steve, I am unmuting you. Please go ahead and ask your question.
Thank you very much. My question would be to the doctors in the forum. I think me and Naomi, we have addressed the issue of flea management, and especially so trying to discourage parents from using, I'll not say the specific brand, but let me say chemicals that have pyrethrin containing in the chemicals. Doctors, please can you use this forum to explain better to the parents who are here why they should stay away from such chemicals? Tafadhali.
I'll not shy away from mentioning the brand. It's Duducrine. So
Yes, some of us have fought with them.
yeah, I think the manufacturer had been consulted and they admitted that it has pyrethrin and cats can't break down pyrethrin. So either they are doing it just because they want to clear the stock, but they had admitted that it's evident cats can't break down pyrethrin, and people have been seeing a bit of problem with that. So my advice to parents, as you say, but to clients who own cats, when you buy a shampoo to use on your cat, read the content. When you read the content, just do a bit of research if whatever content is in there is compatible with that or not, and see at what age you can start using it. If it's if they advise you to use it from kitten age, meaning from 2 weeks onward, then go ahead and use it. If there is no disclaimer on age, I would also advise you that if you can't find any literature, ask a vet whether that compound can be used on cats, and also from what age. Because most animals, before 6 months, their system is not competent enough. They don't have the right enzymes or hormones to break down these chemicals that are used in these shampoos. And most of these shampoo work on residual effect, meaning you can wash your cat today and it remains active on the cat for another 1 week before the effect goes down and you can wash your cat again. So before you put these chemicals on your cat, just see that what content is there and can my cat break it and from what age, so that you don't put your cat at risk. You might be using something that can be used on cats, but your cat is not competent enough to break it down. So you are actually poisoning your own cat, and that can go on because you're using it weekly, and the cumulative effect is there. It accumulates, and it knocks off the cat's liver, and now your cat is actually dying. And sometimes the vet cannot help much when the liver has failed.
Okay. All right, thank you. I don't have any more questions, so I thank you. I thank you everyone for joining us. I hope the session has been helpful. We will be back next week with a different topic and with a different vet. If you want to reach out to Dr. Desmond, you can always find him online, or you can reach out to me for contacts. Let me just share my screen and you can maybe take a screen grab quickly. I have posted everybody's contacts here. So contacts I'm sharing here are for Dr. Desmond, for TNR Trust. TNR Trust, as we've mentioned, they look to support especially underprivileged communities and to manage stray populations. KSPCA, as you know, is a shelter and is very involved in animal welfare, so you can always reach out to them. And we have a new entrant in terms of the shelter, Nairobi Feline Sanctuary. They also rescue and shelter cats. You can also reach out to them to see how you can help them. So yeah, you can find the podcast. At the moment, we are only on Facebook, so reach out to us directly on there. I've posted my email address for this webinars and subsequent podcasts specifically. You can email us with questions as we come up with topics for the next sessions. And for those who know my work and what we do, my online community is Cat Lovers Kenya, and there's also a Real Dog Lovers of Kenya on Facebook. So you can join those communities if you want to interact more with animal enthusiasts and pet owners. Steve has one more question. Steve, go ahead. Do I need to unmute
okay,
you?
thank you.
Okay.
Thank you, Naomi. So I'd love to ask Dr. in regards to June's situation. Let me shed a bit of light. Let me say June is my neighbor and I've interacted with her cat let me say on daily basis, and I see the kind of suffering the cat goes through. So in such a condition where the cat is suffering from the cleft palate kind of condition, what kind of food would you advise her to feed the cat so as to minimize the irritation of the food in regards to the nasal passage?
Okay.
I would advise more liquid food, so that in case it goes into the nasal cavity, the reflex of sneezing can flush it out as fast as it can.
Okay. So not the hard pellets that will get stuck.
No.
Okay. June, your hand is up.
So she's unable to drink like most liquids. So initially she was able to drink milk, or like the omenas that are the powder ones that have been crushed. So right now she can't drink milk. She can't drink like liquidy foods. I don't know how to put it, because every time she takes it, I think it goes to her nose and she sneezes it all out. So that usually irritates her. So what I do is just give her mostly like solid food, because that most of the time she just chews it and doesn't sneeze. But anytime I give her like milk or something that just has some mixture with water, she sneezes.
Okay. Dr. Lillian has a comment.
Yes, I was just going to suggest that a patient like this would be ideal for what we call a nasogastric tube. And this is just a tube that's put through and allows tube feeding. So it's sort of artificial feeding that goes directly into the stomach. And with some owners, you can actually have very good training on how to use the tube while healing is occurring, and especially if surgery needs to be done. So it's still possible to have long-term, and you can check out quite a number of YouTube videos on how feeding tubes work. So it's actually possible to have a feeding tube installed. So as they go see their vet, they should actually, those are some of the things that may happen. But in terms of liquid, I totally agree with what Dr. Desmond has said. So avoiding the sort of solids and the porridgey food, just in case there's an aspiration.
Okay, and Dr. Olum has chimed in on chat. He says, it really depends on the size of the opening. Some liquid feeding may be worse for the animal just because of how it's going up through the nose. So I guess it's maybe on consultation, then you can decide the best course of treatment for best way to manage the situation for the cat. And I had shared a link with you for the kitten lady. She's been raising a cat. I don't know if, okay, so the kitten lady is a foster and rescuer who lives in the US, and she's very popular. She's been raising a kitten called Tutu, who has survived through tube feeding. And they were considering what Lillian was saying. Sorry, Lillian, I've forgotten what you've called it. The gastric tube. They were considering putting in a permanent one. So they were giving the kitten a bit of time to grow, but she's become quite adept at feeding him through tube feeding, a tube inserted through the nose, I believe. So that's what she's been doing, and the kitten has really grown and become healthy. So in a matter of time, they will insert the permanent tube to allow better feeding. So just look at that page and what she's been doing for Tutu. Maybe it will give you a bit more of insight on that. All right, so thank you, everyone. I really appreciate it for joining me on my first webinar, the podcast. We hope it will grow bigger and better. My aim is, again, to educate people better and to raise more awareness about how to treat our animals better and to improve their welfare. Yeah, feel free to reach out for me. With the vets, I will be reaching out to a lot of you as guest veterinarians to help me discuss these topics. Don't worry, I will be calling you very soon, as usual. You know I get my help from you. So thank you so much again for your support. This has been lovely. And that's it from me and my many children. Thank you. Thank you, Dr. Desmond, for being our first guest.
Thank you so much, and good night, everyone.
All right, good night.